Hey there, welcome to another episode of the Health Tech News brought to you by Medics in Tech. My name is Guri and I'm excited to welcome you to another news update where I talk about the activities and the events that's been happening in the world of health tech, especially in Africa. I have interesting news for you today, but before getting into it, let's catch the highlights. Smart Africa Board validates digital health blueprint to build a single digital health market. Egypt unveils 2025 to 2029 health strategy to modernize care system. US backs $150 million Zipline expansion to transform Africa's healthcare delivery. And lastly, SORA Technology leveraged AI and drone to combat malaria in Africa. I know you can't wait to hear the full details, so stay tuned and I'll be right back. Welcome back. First on the news, Smart Africa Board validates digital health blueprint to build a single digital health market. The Smart Africa Board Head of State has officially validated the Smart Africa Digital Health Blueprint, a landmark framework set to transform how health systems across Africa connect, communicate, and deliver care. This blueprint lays a foundation for a single digital health market in Africa, bringing countries one step closer to seamless, secure, and people-centered health services. Now, this blueprint is summarized in these 6 points. A unified standard-based approach for digital health adoption, secure and interoperable health information exchange, stronger system performance powered by innovation, clear guidance on governance, policy, standards, workforce, and infrastructure, practical pathways for implementation through robust technology platforms, and a focus on long-term sustainability and financing. Now, the next step to this blueprint is establishing governance of the Smart Africa, which will implement the single digital health market for Africa, or in other words, the Africa health data space. What do you think this means for Africa? Coming together to have a single health data space. I think this is a good initiative, as we cannot undervalue the importance of data in healthcare delivery. But let me know your thoughts in the comments. Okay, next on the news. Egypt unveils 2025 to 2029 digital health strategy to modernize care system. Egypt officially unveiled its National Digital Health Strategy 2025 to 2029 on Saturday, November 15, presented by Minister of Health and Population, Khalid Abdel Ghaffar, during the 3rd World Congress on Population Health and Development. The roadmap sets the foundation for a fully digitized health system by 2029. Well, I'm already excited at the thought of a country having its entire healthcare system digitized. And in 5 years? I am excitedly looking forward to it. Now, the key measures in this plan include consolidating national health data, building secure and interoperable digital platforms, and expanding access to online services to improve the speed and reliability of patients' monitoring. This initiative falls under the broader Digital Egypt 2030 transformation strategy, which places health amongst its priority areas. Again, way to go for Egypt, and can 2029 come already? Because I'm looking forward to it. All right, let's move on to the next news update. Next on the news, US backs $150 million Zipline expansion to transform Africa's healthcare delivery. The US Department of State has announced a $150 million investment in Zipline, a leader in autonomous logistics, to enhance healthcare delivery across Africa through its drone delivery network. This partnership marks a new approach to foreign aid, focusing on result-based financing that encourages local governments to commit to operational costs. Zipline's expanded network aims to serve over 130 million Africans by providing on-demand delivery of essential medical supplies, tripling the number of health facilities served to 15,000 and creating over 800 high-skilled jobs. This initiative, which aligns with President Trump's America's first foreign assistance agenda, could unlock up to $1 billion in annual economic benefits by improving supply chain efficiency. Rwanda will spearhead the expansion with plans for a new distribution center and enhanced delivery capabilities, while other countries like Kenya, Cote d'Ivoire, and Nigeria are also set to benefit. Well, African leaders have praised this initiative as a significant advancement for national health systems, addressing critical health challenges like maternal mortality and improving health outcomes across the continent. So finally, America has released their first foreign aid to Africa. This is a good initiative, and I'm really looking forward to African countries maximizing this opportunity to bring true change to the healthcare delivery in the continent. Now, let's move on to the last update for today. SORA Technology leverages AI and drone to combat malaria in Africa. SORA Technology is addressing the malaria crisis in Africa, which affects about 90% of the population and results in approximately 260 million cases annually. The economic toll of malaria is severe, with Africa losing about 1.3% of its economy each year due to the disease. Instead of employing traditional broad spraying method, SORA uses drones to map water bodies across regions such as Abuja and Lagos. The drones then feed data into an AI system that identifies which pools contains mosquito larvae, allowing targeted spraying of biolarvicides like BTI, which are safe for human and aquatic life. And in cases where the areas are hard to reach, the drones can spray directly. Now, this is quite interesting. A study in Ghana showed that SORA's approach reduced mapping time by 62% to 90% and labor time by 70%, ultimately decreasing operational cost by 27%. You will agree that this efficiency is crucial for public health programs that are often strained by budget cuts. Now, SORA is in discussion with Nigeria's National Malaria Elimination Program and plans to extend its operation to other regions by 2026. As African government begins to shift towards evidence-based and technology-driven solutions, SORA represents a promising model for public health in the continent. And that's it for the news. What do you think about all these updates? Do well to share your thoughts in the comments. To ensure you don't miss out on subsequent updates and other opportunities we bring to you from Medics in Tech, subscribe to this channel and ensure your notification is turned on so you don't miss out. Also, if you're building a career in the health tech industry or you just want to keep yourself informed about the opportunities available for you, do also follow us on LinkedIn and TikTok at Medics in Tech. Look forward to the next news update. Bye.